I am Kathy Thatcher, and I will be speaking to you about obesity determinants and interventions among the Mexican American children of El Paso, Texas. To give you an overview, I will discuss the history of El Paso, background of obesity among Mexican American children, the risks, determinants, and interventions of obesity among this population. El Paso, Texas is located in the far western corner of Texas, that small red area, on the U.S.-Mexican border, and has a population of nearly 700,000 people. El Paso and surrounding cities make up the largest binational area, 2.7 million people, an area known as Paso del Norte. The graph will show you in gold its Hispanic population of 80%. There is a concern for the children who come from a community with a high obesity rate, where 2/3 of the population and nearly 1/4 of the children are obese. It does not help the problem to have a significant prevalence of food-insecure individuals. Mexican American children present with unique historical and demographic characteristics. They are more likely to have abdominal obesity. One reason for the larger abdominal girth is the growth pattern of Mexican American children, who generally achieve linear growth similar to kids in the U.S. up until adolescence. A drop-off of linear growth might be related to genetic factors and an earlier onset of puberty. The graph represents Hispanic obesity in children 12 to 17 years old, compared to their African American and non-Hispanic white counterparts. Mexican American children are prone to the negative impacts of obesity on their physical, social, and emotional health, and are more likely to have diabetes, hypertension, and cardiovascular disease, diseases previously found only in overweight adults. Obesity can lead to diseases affecting the respiratory tract, which obstruct airflow and lead to asthma and sleep apnea. These children are prone to skeletal muscle disorders. In the social arena, Mexican American children stand risk to the negative impacts of obesity on their social and emotional health. Obese children and adolescents are more likely to be overweight or obese adults. But obesity that is present before the age of 8 years of age is associated with severe obesity. For obese individuals, there are obesity determinants, such as the geographical location of El Paso, Texas, where there is food insecurity, and its biological and psychosocial stressors. Many food insecure individuals consume excessive amounts of calories from convenience snacks containing sugar and fat, which contribute to excessive energy intake. Most Americans do not consume the required fruits and vegetables, nor do they get the recommended amount of physical activity. So it happens with the Mexican American children. Media contributes to increased energy consumption while snacking on and eating meals in front of the TV. Media also exposes children to unhealthy food choices, and media time replaces time that would otherwise be spent in physical activity. Finally, another determinant of obesity is that Mexican American children belong to a strong familial culture who frequently gathers together to enjoy traditional Mexican dishes comprised of beans, rice, and tortillas, a dietary pattern heavily based on starches. The socio-ecological model might help us understand how the determinants of obesity relate to the individual. The model believes that childhood obesity is determined more than the unmodifiable genetic risk factors of ethnicity, gender, biological and physical characteristics. You can see that in the middle of our circle. Obesity stems from behaviors of the individual, the diet, and the activity. Influences of the interpersonal relationships include parents, family, culture, and peers, which shape one's attitude towards types of food and the desire for activity. The community determines the accessibility to healthy food, safe neighborhoods, and convenient recreational facilities. Government leaders and organizations make policies to assure the safety and accessibility of societal domains. An examination of these entities is paramount in designing intervention strategies and setting priorities. From their investigation, the El Paso County Health Department, Paso del Norte, identified the following unhelpful behaviors among children: too much screen time, limited physical activity, poor nutritional habits, working mothers, a dependence on convenient foods, meals away from home, and high intake of energy-dense foods. Now I will discuss obesity interventions. Physical activity. The El Paso County Health Department, along with surrounding communities and school districts, could utilize health sciences students from local colleges and universities to mentor the kids in healthy lifestyle behavior. The SPARK program, implemented in California, provides an active curriculum that provides an on-site staff the training to hold a PE class where there are different levels of activity going on for the different levels of abilities. The outcomes are to focus on activities that can be performed in class and away from school, and make activity enjoyable for everyone. Parents would receive information at family school nights so that the entire family can see the value of participating in activity together. Next is nutrition. The Family Lifestyle Overweight Program, or FLOW, was experimented with in children of the same demographics in Houston, Texas. The nutritional component of FLOW looks at caloric intake, helps kids select a variety of foods from the food groups, teaches them to read food labels, to limit sugar and fat, and learn correct portion sizes. Children can learn this practical health application right in school. Children should have the opportunity to visit the supermarket and be included in the food selection process. Food vouchers could also be distributed as an incentive for buying fruits and vegetables. Another intervention ties in with the family. Family-based interventions are more effective than interventions focused on the child only. Overweight children often have overweight parents. We need to teach the whole family how to make wise food choices when visiting the grocery stores in their area. Parental meetings could discuss healthy food preparations and snacks, state the importance of physical activity during leisure time, and help them set goals. But parental correspondence can often be challenging due to their work schedules and transportation. It will take creative ways of communicating through posters, text messages, word of mouth, school websites, or eye-catching handouts. If we can reach the parents, we can teach them to use the same techniques to improve their own health and monitor it for their children. As I conclude this presentation, I would like to recognize the Food Trust Partnership for taking the initiative to bring supermarket access to the low-income communities of El Paso, Texas. Nutrition interventions are a challenge to execute when healthy, fresh food is not an option. Food for every child means a food-secure child, and food security is a big step toward obesity prevention. Thank you for listening.